It's a tough act to follow, but we'll give it our best shot here. Colleagues and friends, welcome to the 2019 Society of University Surgeons Presidential Address. My name is Greg Kennedy, and I'm extremely honored to present our SUS President, Dr. Alan Sung. Alan is an amazing surgeon scientist. He currently has 2 active R01s and has published over 170 peer-reviewed manuscripts, most of them in top-tier basic science journal. His CV is dozens of pages long, and he has accolades that are in line with what you would expect. Because of his many accomplishments, Alan was recently recruited by Dr. Tim Pollack to Columbus, Ohio, where he is the current chief of surgical oncology, leaving his longtime position at Pittsburgh, where he was the Raisman Haney Chair and Professor of Surgery in the Division of Hepatobiliary and Pancreatic Surgery. But the goal of this talk is not to tell you what you know and what you can learn from his CV, but to give you some insight into the personal side of the man we all know to be a thoughtful, determined, and dedicated surgeon scientist. Alan was born in Cincinnati in 1973 to Pei Nan and Lida Sung. His parents emigrated from Taiwan in the 1960s to study. His father received a PhD in physics, followed by an MD from Cincinnati, while his mother received her master's degree in library science from the University of Kentucky. Even though his parents grew up just a block away from each other in Taipei, they did not know each other and met in Cincinnati. Alan was born in Cincinnati, and then 3 months later, they moved to Buffalo, where his father completed a residency in radiology. About 15 months after his birth, his sister Jennifer was born, and they were fast companions, friends, and competitors, depending on the year. It was here in Buffalo, though, that Alan developed a love of science and medicine. His mother told me that Alan was a very naughty boy. I think what she meant was he was very busy and highly intelligent, and to keep his active hands from being naughty, his father would take him to work and get him using the microscope, reading books, playing with a typewriter. Here's Alan at the age of 3 in his dad's office, sipping his morning coffee and typing away, just like most 3-year-olds. This was a very common scene in those early years, and through this exposure, it became clear that Alan wanted to be a physician. In fact, Lida tells me when he was 6, he declared without hesitation, "I'm going to be a surgeon." Family was very important to Alan's parents, as was their Chinese heritage. Here's a picture of Alan running away from his mom somewhere in Taipei. It's interesting to note that Alan does not have a Chinese name, in fact, doesn't have a middle name. His mom told me they just didn't think about it. However, Alan's grandfather wanted to ensure he knew who he was, so Alan was given the nickname Han Min, which means Chinese people. Grandfather wanted him to remember where he came from, and Alan most certainly has tremendous respect for his roots. Alan's father loved his family more than anything. All of their trips were geared toward family, kids, zoos, museums, national monuments, actually a bone of contention for his mom, but it was very important for them. He really had a pretty normal childhood. He enjoyed music, enjoyed playing the trumpet with his shirt off. He played baseball and really just hung out with friends. But at the age of 15, Alan's world was turned upside down. His father died of metastatic colon cancer. He was thrust into the role of helpmate for his mother, who then went to work full-time, selling real estate and working 2 to 3 other jobs in order to provide for her family. In the meantime, Alan told his mother, "Don't worry, Mom, I'll help out and we'll be fine." He started mowing lawns, delivering newspapers, really doing anything he could to contribute to the family's finances. He also took over cooking and cleaning, as well as shuttling his younger sister Jennifer to various events. I'm told by his mother that he would actually call her while she was at work and say, "Hey, Mom, have you eaten yet today?" And when she said no, he'd say, "Well, come home, I made you dinner. Get home, you got to take care of yourself." While some young men would be thrown off by this loss of their father at this critical time in their life, Alan's drive was bolstered. He studied harder, becoming the best biology student in the school. He got the best grades, tutored other students. His mother couldn't quite understand this because she tells me biology was so incredibly boring. And she asked him, "Why do you study like this?" His response was, "I'm going to be a surgeon. I couldn't help my father, but I'm going to help others." Upon graduating from high school, Alan had a choice of a number of top schools. He chose to go to Cornell University for several reasons. First, he'd be close to home. Second, it'd be less expensive for Lida. But it's interesting to note that he went to Cornell and spent his first several months introducing himself as the following. "Hi, my name is Alan. I actually shouldn't be here. I should be at Stanford. This is my backup school. But finances were very important to Alan at this time, and he understood the strain this put on his family. Not surprisingly, he worked hard at Cornell, majoring in biology, and graduated cum laude in 1995. The best thing that happened to Alan at this time, however, was he met the love of his life, Eva. He met her as a senior, and his friends tell me they were surprised when Alan and Eva started dating. Alan, they said something about you punching above your weight class. I think they thought Eva was too good for you, and I'm not sure, but I think that's what they were getting at. They dated throughout graduate school. Eva was a pharmacology student at Columbia, where she received her PhD, and Alan was at medical school at SUNY Downstate. During medical school, Alan received many awards, the best of this, the best of that, etc. But probably the best thing that he did during this time was he took a year off and spent at the Cloister at Howard Hughes, where he worked with Steve Rosenberg studying tumor immunology. In fact, one of the first papers on his CV is a paper published in Journal of Experimental Medicine, in which the group induced self-reactive T cells using an altered peptide ligand, the sort of thing that most third-year medical students do for sure. This single year really allowed Alan to find his true passion and started him down the path of being the outstanding surgical scientist he is today. It's clear Alan's an academic superstar. He went on to Pittsburgh to complete his residency, and during his residency, he published over 40 basic science manuscripts. Shortly after starting on faculty at Pittsburgh, he received his first R01. Like I said, his CV is dozens of pages long and filled with accolades, and by far the smartest guy I personally know. But I don't think this is actually the most important thing about Alan that you should know. The fact is, he and Eva are great partners. He married Eva shortly after his intern year, and like many of our best residents, took a long weekend, got married, and took his honeymoon. Now, Alan, just a piece of advice here. I just got a sense of resentment from Eva over this lack of honeymoon. After the year you've just given her with your presidency, move to Columbus, the house in disarray like this, I think perhaps a couple of weeks in Hawaii is deserved. I'm sure Tim will give you the time off. Alan knows an incredibly dedicated family man. His daughter Carolyn was born in 2003 and his son Peter in 2005. He is a dad and husband before anything else. His daughter is an outstanding tennis player and Peter is an all-star baseball player. When you talk with Alan on the weekends, you'll have to deal with fan noise in the background because I guarantee you he's either at a tennis tournament or a baseball game. In fact, one of my favorite memories of visiting with Alan was listening to cheer for Peter when he went yard at one of his baseball games. Alan puts his family truly above all else. Even when he takes trips with his college buddies, his family goes with him. There is really no doubt where his priorities lie, and who can blame him? He's been an outstanding leader of the SUS. As treasurer, he assured our finances were on solid grounds, enabling us to develop new grants and collaborative programs. Under his presidential leadership, we're developing many new collaborations with SAS, American Surgical, SSAT, and others. His impact on the SUS will be lasting. Let me wrap this up, introduce you to the consummate surgeon scientist, father, husband, my friend, and our current SUS president, Dr. Alan Sung.
Thanks, buddy. Well, thank you, Greg. I knew you would have a fun time trying to make fun of me and try to embarrass me. But I want to say something to you in Chinese. 新年快乐. Don't worry, I didn't just curse at you. For those of you in the room that understand what I said, I think you'll know why I said it. I'll repeat it again. 新年快乐. That's actually Chinese for Happy New Year. And oddly enough, today, February 5th, 2019, is the actual Chinese New Year, the Year of the Pig. It's actually quite fitting that we're all here today during Chinese New Year, because the most important part of Chinese New Year is gathering, reunions of family, of friends. And here in Houston is a gathering of colleagues, friends in academic surgery. Don't worry, I won't try to teach you any more Chinese, but I will share that one of the taboos of Chinese New Year is to carry anything sharp. Scissors, knives. The superstition is that you'll cut your stream of wealth and success. So it's a good thing we're actually here in Houston and not in the ER, right? Being here today is actually a bit of a new beginning for me. For those of you that have made transitions in the middle of your career, you know exactly what I mean. If you asked me 6 months ago, could I see myself at an institution other than University of Pittsburgh, I probably would have laughed and said, no way. I think many of you here would have said, no, there's no way he's ever going to leave. Why would I leave a place where I spent almost 20 years of my life? Starting from internship all the way to finishing fellowship, where I learned to be a surgeon scientist, where I began as junior faculty, and also became all the way to full professor. A place where I thought I had built the perfect clinical practice, where I'd had an environment where my research was thriving, and also a place where I got to work with amazing mentors, colleagues, and friends. I distinctly remember that day last summer. I was running around clinic, always late behind from seeing my patients. You know what it's like. You're running around, patients are piling up, and then your cell phone rings. I look down, it's Tim Pollock. Hey, Alan, there's a great opportunity here at Ohio State I want you to look at. He then spent the next 10 minutes talking about the amazing things that were happening in the Department of Surgery, the James Cancer Center, and the university as a whole. Sorry, Tim, I probably lost you after about a minute or so as I was seeing all the patients starting to pile up on the screen. But I do distinctly remember the last thing he said to me. We're building something very special here, and I think you will really thrive. Go Buckeyes. So I kept thinking, was I not thriving? And what the heck was a Buckeye? I never was a great, college, sports fan, but I did find it annoying that Ohio State athletes would always say, I'm from the Ohio State University. Was there another university that people mistaken it for? And did you guys know that a Buckeye was a poisonous nut? Why would you name a mascot after a poisonous nut? But luckily, Tim gave me an amazing opportunity to work with such wonderful people. During the interview process and preparing for my new position, I had to do a lot of thinking, do some soul searching. When I like to clear my head and think, I usually like going for a run. I think most of us here like running for exercise. It's pretty easy. You just put on a pair of sneakers and you just go. One Saturday morning, I decided to go for a long run. There's a nice park near my house. There's a paved road exactly 5 miles around a beautiful lake. It was early in the morning, slightly drizzling, not too many people around. I could actually think to myself. The previous night, I was going over my CV, so it was fresh in my head. A CV in academia is really a story of your entire career. It's what gets you into residency, fellowship, a new job, a different job. It's what institutions use to evaluate you for promotion. I was thinking about my CV, and one thing kept popping into my head. Much of my accomplishments on my CV had nothing to do with why I chose a career in academic surgery. What was buried or not evidenced was a driving force or the passion to why I chose this career path, and also why I stay satisfied and focused. I actually stopped running, and I thought to myself, do I even have passion for academic surgery anymore? Or am I a surgeon working at an academic institution? I thought that was pretty bad. I'm the current president of the Society of University Surgeons, and I was about to lead a group of faculty where my goal was to provide an environment where the academic passions would thrive. I think everyone here has a different reason for going into academic surgery, but I think most of you have a desire to do something to make an impact beyond the patients that we operate and take care of every day. I thought it was so much easier in the beginning when my desire to go into academic surgery was to make an impact in medicine. As Greg pointed out, this is my father. He was a radiation oncologist. I used to love going on the weekends to his office in the sub basement. No one was there, running around, just looking at the cool machines. My father dying of metastatic rectal cancer to the liver was the spark that led me down this career path. Everything I did from then on was for a purpose, to try to increase the understanding of care of patients with this disease. And I think that is the essence of academia, to make an impact. Our society needs surgeons that want to make a broader impact, who want to lead in advancements through scholarly activities, as well as to educate the next generation of surgeons that also want to make a broader impact. But that's easier said than done. I remember when I was a fourth-year medical student, I went to a session at the American College of Surgeons. There we had a session for fourth years interested in going into surgery. A surgeon said to all of us, I want you to think of one thing you want to make an impact on in medicine. Write it down on the piece of paper in front of you. After about a minute or so, he then said, now go find your passion and you will have a fulfilling career. Back then, I thought that was pretty inspirational. But when I think about it now, I actually think that's horrible advice. How many times have someone said to you, go find your passion, go pursue your passion, and then stop there? It's as if that's a magic bullet for a satisfying career. And more importantly, finding your passion and staying on the path are not the same. Maintaining your passion for what originally excited you to pursue this career path is much more difficult. So since that run, and planning for my transition so far, I've intentionally asked myself, what fuels one's passion? What maintains one's passion? What are the seeds of growth and success? I reviewed my past and also many people that have influenced me. And I can summarize them into three characteristics: curiosity, perseverance, and adaptability. I'm not going to stand here and lecture or preach to you about each of these, but instead, what I would like to do is bring forth stories of remarkable surgeons that embody these characteristics. Let's start with curiosity. Dr. Timothy Billier is someone who I owe much of my accomplishments for. He's the chair of the Department of Surgery of a great academic department. He's an administrator at a huge healthcare system. He's also a surgeon scientist. Most people describe Dr. Billier as intense, intelligent, focused, and for most of us as residents, pretty darn intimidating. One of the qualities that I think most people don't know about, but actually one that I respect the most, is actually his curiosity. Let me tell you what it's like to be a surgical resident at Pitt. During training, after PGY3, everyone would spend 2 to 3 years and go do research in a research laboratory. We all had a mandatory research meeting every week. It was supposed to be informal, presenting raw data, get feedback. But with Dr. Billier and Dr. Simmons, our previous chair, sitting in the front row, we as residents would spend days working on our presentations, trying to show our best data. If you're like me, I spend a lot of time on the results section, and I pretty much skim over the background. But without fail, within 2 to 3 slides of my presentation, Dr. Billier would start asking me questions, interrupting my flow. At first I would ask, why is he even asking me these questions? But when he thought about it, these questions made me reevaluate my research. Was it significant? Was it innovative? Was it clinically relevant? I didn't realize it back then, but he was teaching us how to be a surgeon scientist. And then when I got to the results section, the questions got even worse. I realized that I hadn't thought about everything, and I wasn't as smart as I thought I was. Throughout the years, I realized that Dr. Billier doesn't ask all these questions because he wants to show how smart he is, but he truly is curious about everything. He taught me that the qualities of a master clinician and a master scientist are exactly the same. So when there's a patient nobody knows what to do with, what does the master clinician do? He or she walks into the room, he first collects all the data, then analyzes it, but the thing that separates them out is that he or she is curious enough to go find an answer. So whether it's in a huge auditorium or just a small room of residents giving a talk, at the end of the presentation, you always see Dr. Billier either raise his hand or walk up and ask a question. For the next person, let's try something different. Let's play a guessing game of who am I? This is a person who was inducted into the Hall of Fame in both high school and college for athletics. She was the first female surgical resident appointed in Boston, first woman to be full professor of surgery at Harvard Medical School. She's the first woman to lead a surgical division at Mass General Hospital. For those of you who are pediatric surgeons, I think you know who I'm talking about. Dr. Patricia Donahoe. She was the chief of pediatric surgery at MGH from 1984 to 2003. I recently heard her talk at a surgical biology club. I was blown away by so many things. First, the sheer number of groundbreaking discoveries she had over her career. How could one person have done so much? Second, was the fact that she was keeping up with the pace of science. She was describing research techniques such as single-cell sequencing, using computational biology to answer questions using a systems biology approach. Approaches I can barely keep up with, let alone understand. The most impressive thing was that she finished clinical work in 2004, but to this day, she spends over 10 hours a day in her research lab. Her colleagues say she has so much energy, she has so much curiosity. I asked her one day, what drives her curiosity to continue asking questions? And she told me, when you're in the clinic, you hit a wall pretty quickly in terms of knowledge needed to help your patients. She then gave me an analogy of peeling an onion. Your initial questions are like peeling the first layer of the onion. The superficial answers you get limit you in what you can do. But the deeper and deeper that you start peeling and getting into the onion, the more knowledge you gain, the more you can help your patients. But she also said, as you dig deeper into the onion, you acquire more humility because you're always coming in as a neophyte, a new student to a field. To stay cutting edge in your search for answers, you always have to be able to retool, to relearn things. And I think that is what keeps her passionate about her work to this day. I think curiosity is often an underemphasized quality for maintaining one's passion. Curiosity is the thirst for knowledge, learning new things, not being afraid to ask questions, even questions where the answers have already been given. What I love about this meeting is that there are surgeons at so many different stages. If you haven't found your passion, then curiosity, by nurturing your curiosity, will allow you to try different things until you find something that interests you long enough so you become an expert. And for those experts out there, nurturing curiosity will help you venture outside your field of expertise. We all know that innovation tends to stagnate in isolation. But when you bring ideas from two different areas, you'll get the most creative solutions. Let's move on to perseverance. There are a few people that characterize perseverance that the next two surgeons I will highlight. Dr. Steven Rosenberg. He's a pioneer of cancer immunotherapy. I really had the privilege of working with him as a medical student. Back then, I was frustrated with surgery, chemotherapy, radiation. They didn't seem to do much for my father. But I read about immunotherapy, and I found it so exciting, using your own body's immune system to fight cancer. Back then, I wasn't sure I was going to be a surgeon. I didn't even know Dr. Rosenberg was a surgeon. But he was the first to introduce me to the concept of a surgeon scientist. And to this day, he's been a role model for me in terms of perseverance. For most of us that have worked there, you probably heard the story of how he started his quest to study the immune system to fight cancer. In 1968, he was a junior resident at Brigham Hospital. He was evaluating a patient for cholecystitis. And when he was looking through the medical records, this patient was actually open and closed 15 years ago with a diagnosis of metastatic gastric cancer. How can this patient still be alive? And then after the cholecystectomy, he found no evidence of any disease. This patient should have died a long time ago. Because of that event, he's devoted his life to studying the immune capacity as cancer treatment. Immunotherapy is the hottest trend these days. But what most people don't realize is Dr. Rosenberg has been working in this field for more than 40 years. And alongside his long list of accomplishments are also many setbacks. Immunotherapy was not as promising as it is now. Critics were always saying immunotherapy always overpromised and underdelivered. I remember in 1997, I was working on tumor vaccines in his lab. Dr. Judah Folkman came to give a talk at the National Cancer Institute on his work with anti-angiogenesis for cancer treatment. Now, Dr. Judah Folkman was like a rock star for scientists. People were running to the auditorium, trying to find a seat. It was packed, standing room only. He gave a fascinating lecture on the responses of patients that he treated with multiple myeloma using thalidomide, anti-angiogenesis agent. I don't remember his talk so much, but I do distinctly remember afterwards, as we were walking back from the auditorium back to the lab, people were very quiet. It was almost like a depressing air. People were whispering, we should be in another field. Immunotherapy is never going to work. We can't even cure mice. Look at what they're doing for humans. I distinctly remember talking to Dr. Rosenberg about Dr. Folkman's work. He always had a smile on his face, and he said, yes, it's so fascinating. But he said, I'm confident that immunotherapy will have a role for patients with advanced cancer. And he continues to persevere till today. He's a pioneer in developing effective immunotherapies for patients with cancer. He's also a role model for generations of surgical oncologists. And he's an example of trying, failing, retrying, and failing again and again to answer a question that begun when he was a resident. Let's play another game of Who Am I? How many people here know of a surgeon that's been featured in GQ magazine who had a documentary movie made about him? The same surgeon was called Dr. Frankenstein. His work was labeled grave robbing, cannibalization. Being at Pitt, I had the privilege of working with one of the greatest surgeons of the 20th century, Dr. Thomas Starzl, a father of liver transplantation. And up to the day he died 2 years ago, he would always be walking around our offices and around the institute that bears his name. What people think of standard of care today, transplant, was actually science fiction when Dr. Starzl began his career in the 1950s. Most people don't know that the experiments that laid the groundwork for his quest to transplant organs started in an empty garage across from Jackson Memorial Hospital ED in Miami. Then in 1 year alone, he used up 10% of the country's research dogs. day after day, rerouting their bile ducts, the vasculature, stitching in one liver, two livers, no livers, just to see what would happen. I don't think IACOC would approve today. They were bloody operations. All the dogs died. Finally, he was able to report 18 dogs that survived 4 days. Then in 1963, he attempted to transplant a human liver. It was a 3-year-old boy with biliary atresia. This is actually his original opno. You can't see it here, but for those vascular surgeons out there, Dr. Rutherford is actually the chief resident that assisted him in this case. Upon release of the clamps, the liver immediately assumed a good color. And despite the hectic circumstances of the transplant, it was initially thought that a good result would be obtained. However, after about 15 or 20 minutes, it was noticed that all raw surfaces were profusely bleeding. The next 5 or 6 hours were spent in a desperate effort to control hemorrhage, using literally thousands of sutures and ties, but the hemorrhagic diathesis could never be satisfactorily controlled. This patient died on the table. He tried again. Second patient died. Third patient died. Fourth patient died. A fifth patient died. His surgeons around the country were blasting him. This operation is too difficult. It should never be done. Journals were criticizing him. His work was a violation of medical ethics. Dr. Starzl actually put a moratorium on himself. And for the next 4 years, he spent day and night improving surgical technique, cold storage, and importantly, immunosuppression. Then in 1967, he performed the first successful liver transplantation. And to this day, thousands of patients have benefited from this operation. These are Starzl's children, patients who underwent liver transplants when they were infants or children and have lived to be young adults. Being at Pitt, I had the opportunity to hear about his perseverance and his never give up attitude. Did you know that when he was growing up, he wanted to be a priest? And then his mother died of breast cancer. That grief actually overwhelmed him and changed him. From then on, he refused the no of death. That led him to refuse death for all his patients that were dying of liver failure. I love his quote: "The space between a heroic event and being an outcast is not that great." To me, that's perseverance. Everybody wants to succeed in their career. Pursuing one's passion is a popular goal, but it's rarely achievable without perseverance. What I've seen in the lives of Dr. Rosenberg, Dr. Starzl, is that exceptional achievers are willing to push themselves further and higher. They set goals for themselves, but most importantly, they hold themselves responsible for attaining them. The 4 surgeons I highlighted are just a glimpse of many surgeons we all know that have extraordinary passion for making an impact. You can see throughout their careers curiosity, perseverance resonating through that helps them maintain their entire careers. However, a third quality I think all of them have is actually adaptability. All these surgeons had to learn to be adaptable, sometimes reinventing themselves to an ever-changing environment. They've had to adapt to changes in their field, advances in knowledge and technology, and also had to adapt to challenges that they face at their institution and medicine in general. One obvious face of adaptability is actually the field of academic surgery ourselves here. Just look at this meeting. I hope you appreciate where you are. I think Dr. Rickers mentioned it. Things have changed so much in just the 20 years I've been attending this. I remember going to separate SUS and AAS meetings. And then 14 years ago, the two societies decided to co-sponsor the ASC. And now the Academic Surgical Congress is the largest gathering of academic surgeons in the world. For my colleagues in the SUS, probably remember when you were in training, the path to our mentors was through basic science. And if you ask most people here what has been the biggest change throughout the past few years, I would say most would say that the proportion of basic science abstracts being presented here has decreased. Many of us in the SUS remember everyone going into the laboratory during residency. However, I knew that many of my co-residents didn't have a passion for doing basic research, but they did it because that's what they thought was the path of success. I love basic research, and I can stand here and lament and say there are fewer surgeons doing basic research. However, I actually see academic surgery adapting to the changing environment, adapting to our constituents. Just look at the number and growth and type of abstracts being presented. There are so many more types of scholarly activities, even beyond research. We're finding as a society there's more than one way to define success and more than one ways to define impact. So I will end where I started, with the Chinese New Year. The flower is actually an important symbol in Chinese New Year. I think a flower is very similar to passion. To have a perpetually blooming flower, you have to continue to nurture it with curiosity, perseverance, and adaptability. I invite you to take inspiration from the lives of the 4 surgeons I highlighted, as well as later on today at the SUS presidential session, lives and careers of 4 surgeons from very different paths, but have made tremendous impact in surgery, medicine, and society. And also invite you to take inspiration from this meeting itself, all the people here that have such exceptional passion for academic surgery. Think about where you are. The field of medicine, becoming a surgeon, following the academic path, I think it's probably one of the most challenging and difficult paths out there. We constantly face many obstacles, many difficulties, but we don't have to do it alone. My good friend Greg Kennedy said in his blog of why he joined the SUS, finding a peer group that share your priorities and values is critically important for all professionals. Without peer groups, we run the risk of feeling alone in our daily struggle to accomplish our personal and professional missions. I'm so grateful that I have friends in surgery that share a commitment to academic surgery. I get so much inspiration from all my friends here. They have so much passion, have so much sacrifice. Thank you. I'm not done yet, so. Yeah. I also wanted to thank all my new friends at Ohio State, those that have been so welcoming to myself and my family. I especially want to thank Dr. Ray Pollock, Dr. Tim Pollock, and Dr. Craig Kent for entrusting me in sharing their vision. Actually, can I have my slides back? Oh. And of course, I have so much gratitude for my family at University of Pittsburgh. There are just so many people that it's just individually impossible to thank. But I do want to thank specifically Dave Geller, Wallace Marsh, my teachers, my partners, my friends, and also all the house staff, the residents and fellows throughout the years that have contributed to my accomplishments and that continually inspire me through their excitement, for wanting to make an impact in surgery. Finally, I want to thank my family. I didn't realize it, but my sister, my mom, and my sister's family are here. Thank you for sharing in this event. This is my daughter, Carolyn, my son, Peter. You're the love of my life. You bring me so much pride and a lot of joy. Thank you for helping me strive to be a better person so I can be a better father every day. I especially want to thank my wife, Eva, my best friend, my soulmate. We've been through so many stages of life. You've been a cornerstone, always side by side, many times leading. I know it's hard to leave a home where we've been for 20 years, but I'm actually very excited for the next chapter of our lives with our family. And I really want to also thank my mother, who I didn't actually realize she would be here. She told me that Chinese New Year was more important than coming to see her son. But for all the sacrifice, well, thank you, Greg, for arranging that. But I want to thank my mom for just all the sacrifices she's had, the difficulties throughout our lives, and I hope I've been able to make her proud. I want to thank everybody for allowing me to represent the Society of Neurosurgeons this year.